And Jason is busy making sure the needs of South Union Township residents are addressed and is committed to serving you.
You've got a friend in me. When the road looks rough ahead and you're miles and miles from your nice warm bed, you just remember what your old pal said. Son, you've got a friend in me. Yeah, you've got a friend in me. You've got a friend in me.
And at 11:10 on this Monday morning, time for Best in Fayette, Albert Gallatin Amedisys Home Care and Hospice. And joining us as always is Amanda DeGespie. Amanda, how are you today?
Good morning, TJ. I'm great, and I brought a special guest with me again, Miss Donna, our nurse practitioner.
Good to see you again, Donna.
Good to see you again.
So on behalf of Amedisys Hospice, we just want to thank you for having us today, and a reminder that we go anywhere a resident or patient calls home, and we do cover all of our surrounding counties, Washington, Fayette, Greene, Westmoreland. Anywhere a patient calls home, we have a care center near you. So if you or a loved one can benefit from the gift of hospice, we encourage you to reach out. You can call 724-439-4440, and that's the 24-hour line. You can ask for me, Amanda, and I will get you wherever you need to go. Miss Donna, you have a very special topic. Can you tell me what you're going to talk about today?
Yes. One of the greatest challenges that we have sometimes in healthcare is a lack of understanding and really a lack of communication because there's so much information out there. So I wanted to talk today a little bit about the differences between palliative care and hospice, and also to help you to identify how many people really deal with chronic illnesses. Do you know, I read that there are over 12 million people in the United States who are currently living with a chronic illness. And chronic illnesses can be such things as cancer, Parkinson's, complications with diabetes, frailty, dementia, so many things.
A lot of times people hear that word hospice and they think that it's just for cancer diagnosis, but it's really come a long way over the years.
It has. And so sometimes then people get confused. They hear, should I look at palliative or should I look at hospice? So I wanted to just briefly look at the difference. So palliative care is looking at curative care. And so someone that's going to be palliative, it could be early on in the chronic disease, but their focus really, and their family's focus together, is on aggressive treatment, and it is actually going to be paid usually by the insurance company. And again, you can be in your home or wherever.
Right.
But what we found is that individuals who just have palliative care, in the last month of their life, 50% of them end up in the emergency room. How many people do not want to go to the hospital? Think about the burden that it has not only on the patient, but the caregivers and the stress that the caregivers have. One of the real benefits of hospice, which is a Medicare, Medicaid benefit, is the entire team of us. We do indeed look at the chronic illnesses, such as all of those frailties, and some of the other things that sometimes people do not even realize they have a chronic illness if they've been to the emergency room multiple times. Right. And there's just something going on and they haven't found out yet. Through their treatment, they might find out that they have an underlying chronic illness, that their hope is to remain in their home. And that home can be wherever that is, either assisted living or wherever they're living. And as a team, hospice goes out and we do indeed assist them in their goals of care. And one of the great things is, and one of our focuses, and it is a national focus in the medical profession, is living a good life.
For sure. Quality. Focusing on quality. That's for sure.
Absolutely. And so through hospice, we try to define what does that mean for them? What is it that we can do to help you live your best life?
Absolutely. We have something that we include in our even admission packets. What matters? What matters
Yes.
to you? And I love reading those because at the end of our journey, it's amazing what really matters.
Yes.
Not what you think.
Yeah, it's true. It's true. And most people that I've known through the years that I've been in practice, as well as just even my own family, they don't want to live their last days in a hospital emergency room waiting to get their symptoms managed. So hospice, because we're available 7 days a week, 24 hours a day, we have the capabilities to be able to assist with symptom management. And the symptoms can be many things. Not only, first thing we oftentimes think about is pain.
Right.
Or respiratory, shortness of breath. But there's some of those other things that oftentimes are very concerning to patients and their loved ones. And that is their increased risk for falls, or maybe their need for care, or they're not eating, or that just overall they're not sure what is going on with the patient, but they're just not themselves. In the dementia patient, they're having difficulty with nutrition.
Right.
Our qualified staff has the ability to support them.
Right. It's amazing because we do have a team of just wonderful hospice hearts, but we're all a piece to the puzzle. And you had
Yes.
mentioned like pain, nausea, vomiting, anxiety,
Yes.
emotional distress, things that, at the end of one's journey or during, the process of the decline. A lot of times they need our social worker. Sometimes it's not always just the nursing visit, or maybe
Yes.
a chaplain visit, for prayer or.
Yes, and the greatest thing is that we assist with improving communication. So
Yes.
through communication, a good goal of their care is developed with their needs in mind. Exactly what means most to them
Yes.
and their entire family.
Right, we're definitely not a cookie cutter hospice. We realize that every patient, and I know that you see it, we've talked about it, every patient's dynamics are so different.
Oh my gosh, yes. And we also know that within those dynamics, the one thing that you talked about is anxiety. Anxiety can impact a person's nutrition, and it
Yes.
also can impact their sleep. So it is through that conversation
It's like
that
a
we
domino
have.
effect.
It is.
So many people have asked, it seems like almost weekly I'll have a call and they'll say, well, my doctor mentioned palliative, but not hospice. Can you tell me the difference? So I'm so glad you're clarifying. I think palliative is just such a word, like friendlier word maybe. People are afraid
Yes.
of that word hospice, and that's what we're working hard to change.
Oh, exactly. And again, if one just thinks about palliative is aggressive, and the tough thing is in many chronic illnesses, aggressive treatment is not going to be quality of life, or it's not going to improve.
Right.
So, but what we can do is assist in hospice in having palliative for other kinds of problems that they might have, still be able to assist them with their other health problems. But their hospice, we would be able to provide really good comfort care,
Right.
and allow them to have their best life and have their symptoms managed.
And many times they're not actually receiving palliative. When they call
Yes.
in and they've heard that word, I think it's more easily accepted. But they're not receiving dialysis or chemo or radiation, anything aggressive. And then once we talk about the benefits of hospice, it's like, oh, I didn't know that. I didn't know I could get this benefit.
Yes, and I think the holistic approach to hospice is something that is so beneficial.
Yes.
And the availability of
Absolutely.
being able to have qualified individuals so they don't have to go to the emergency room. Because we do know that in changes in healthcare, sometimes there's just not availability all the time to
Right.
reach out to your doctor.
And there's no place like home when you don't feel good.
Exactly. And so we do have that capability. And because our medical directors are amazing, and they do indeed, they're available to us 7 days a week, 24 hours a day also, for
Right.
us to consult with them for any complex medication changes that might occur.
It's nice because there's not a lot of waiting when you are on hospice services.
Yes.
In fact, if you're a veteran, we partner with the veterans we honor veterans. There may be benefits that you're entitled to. Our social worker can help kind of guide through that. And many times, like patients that are on, I have a patient now that is still receiving dialysis, and they don't have any comorbidity, so they're not quite there yet, but they they're about to graduate because they're just tired. They can't keep doing the dialysis.
Yes. And that's a really good example of someone who is palliative that's moving into hospice because they're just not able to continue to tolerate it. And it's just their body just cannot tolerate that type of treatment. And we do have that capabilities to assist them with all of their needs. And I think, again, the biggest thing is being able to keep them where they're most comfortable.
Yes, for sure. We can go anywhere a patient calls home. Amedisys offers home health and hospice. So if you just have questions, we can point you in the right direction. Just reach out to 724-439-4440, and we'd be glad to help in any way.
Yes, and I think the nice transition there also is if someone is on home care in which they might have had multiple hospitalizations, maybe after a hip fracture, and an elderly person is getting physical therapy, and then now they are declining.
They just can't participate.
Correct. So it's a smooth transition.
It truly is.
Again, the communication is just vital.
Absolutely. And if, I know many times we can do physical therapy, some with hospice. They can do some visits where maybe we're helping with safety with transferring. I'm tongue-tied today. Safety with transferring or range of motion, things like that, too.
And that's really a benefit because sometimes there are individuals who their loved ones really do not know how to transfer or just need a little bit of help understanding a Hoyer lift. And so we do have that capabilities to be able to have physical therapy come in a couple times to be able to not only educate them but make them feel comfortable, and then our nursing staff and aides are able to reinforce that.
Right. Our aides are able to provide things like bathing, dressing, companionship visits. It's so much more support. And like you said, it's an insurance benefit that's covered 100%. So most of the time, 90% of the time probably.
Yeah.
So all they need to do is reach out. We can answer any questions that they might have for that too.
Oh, exactly. And I think the greatest thing that we all can do is just to keep our hearts and our minds open, and to be able to continue to look for communication and education.
There's so many resources out there.
There are, and that's why the social workers have such great benefit to be able to help us to identify any of the other resources that are available. And I think the other really neat thing that Amedisys in Uniontown has that I've just began working with them fairly recently is just the focus on community too.
Oh.
And just how many just positive things that we offer for the community in support of individuals as a whole. Again, always circling around to the best life.
Absolutely.
Quality life.
Yes, we do love our community here in Fayette.
Yes.
Speaking of, we did just receive Best in Fayette, again, Best for Amedisys Hospice. So we're very proud to wear that title and continue to carry that torch. So if you or a loved one can benefit from the gift of hospice, or if you just have questions, you want to dig a little deeper into the palliative aspect, we can always, if you don't mind, I'd like to utilize you to do that education. And we're here for you, 724-439-4440. Ask for Amanda, or you can call me directly at 724-208-9783. And just another quick announcement, we have the Halloween parade coming up. So our community, speaking of community, our theme this year is You've Got a Friend in Community. So we just want you to know that no matter where you are in your journey, Amedisys is here for you, and we want to walk that journey with you.
Yes, and it's going to be great fun. I hear it's great event here in downtown Uniontown, and it is on Wednesday.
It's on Wednesday. And every year I feel like it gets a little bit bigger and a little bit better. So
yes.
It's a lot of fun. It's a good way just to come together. So we have some local businesses partnering with us to walk with us, facilities, because we know that it takes a village, and we're all here for you. So if you have any questions, reach out. And then do you want to say anything else before we exit?
No, I'm excited about being a part of this. And again, please reach out if you have any questions. We're here for you. To help you live your very best life.
And remember that you have a friend in Amedisys Hospice.
Yes.
And your information one more time, Amanda?
Sure. It's Amanda DeGespy with Amedisys Hospice here in Uniontown, 724-208-9783. We go anywhere your loved one calls home, and we cover all of our surrounding areas as well. We have Fayette, Washington, Greene, Westmoreland, and I've had referrals. People call me for other states. So wherever you go, we can be there. Thank
All right.
you very much.
Thanks, ladies, and we'll see you guys
Thanks.
next month.
Thank
See
you
next
so
month.
much.
Have a
great day.
Have a good week, guys.
And the following program has been recorded for playback at this time. Good morning and welcome to Trust Talk by BBB on 590 AM.